Sure thing. So, hi everyone. It's really a pleasure to be here. And today I'd like to talk to you about behavior change in the context of health apps. And really, what I like about this topic is that it's nothing new, but it kind of got a refreshed energy brought on by the pandemic. And this led to a whole new wave of interest to the field with the rapid migration to digital. So, what I want to share with you is something we refer to as a behavior change heuristic evaluation, and also acknowledge that this work I've done with my wonderful student Kyle. And I'll talk to you about how we applied this to a popular multiple sclerosis app. Um, Before I tell you a bit more about myself, I'll tell you about the design for behavior change because that's why we're here and it's more interesting than me. But really, so I know everyone's familiar with Nielsen's usability heuristics, which basically assess whether an app is usable or not. So the twist with this presentation and with the behavior change heuristics is that instead of asking whether the app is usable, it asks whether the app is conducive to behavior change. So, in other words, can this app actually help a potential consumer, first of all, to embrace it, and secondly, to use it long enough to reach their goal? So, that's what we'll be talking about today. So, as Theo said, I'll introduce myself a little bit too. So, I work at Macadamian Technologies, which is a healthcare consultancy. I'm in Ottawa, Canada. So, 1:40 p.m. right now, joining you from here. And at Macadamian, I work with a wonderful interdisciplinary team where we help our clients co-create digital solutions mostly in the healthcare space that meet user needs and, of course, business needs too. When it comes to my title, it's a mouthful: behavior and cognitive experience researcher. But really, it's a very good reflection of the way I approach my work. So there's kind of two high level approaches or layers to how I go about uncovering user needs. And one of them is the behavior layer that we're all familiar with. So, talking about methods like interviews or observations or usability sessions. But the problem with this layer is that it can only take us that far, right? Like, we all know that users don't always do what they say. And sometimes, even in usability, we see what happens, but we don't really get to the ultimate why, right? Same with observations. So neither one of these methods have full visibility into cognitive processes. So that's where the cognitive layer comes in. And as humans, a lot of our decision-making process is still driven by subconscious aspects, and we don't really know why we do those things. And that's where understanding cognitive science or neuroscience and those methods that like EEG or fMRI that look at your brain, that's where that layer comes in. So I kind of work at both of those two layers. And today, what I want to talk to you about is why I've chosen to talk about multiple sclerosis and look at an app for multiple sclerosis specifically. Then I'll show you, I want to share with you something that we call a person product shared journey. And the value of this, at least for me, is that it helps ground all of these principles, be it behavior change or usability, in such a way that something is mandatory at a given stage. And it helps you understand what to do when. And then the bulk of the presentation, I'll be looking at the 13 behavior change principles and examples of how this particular app either applied them successfully or failed to apply them. So let's just jump in. You may wonder why multiple sclerosis. There's so many medical conditions out there, one more difficult than other and one more popular than other and so on. So why MS? Well, we've chosen it for several reasons, and some are a bit arbitrary, whereas others are really tactical. So for one, I happen to be very familiar with the condition because I've worked at the multiple sclerosis clinic here in Ottawa for several years. For two, it's really, really prevalent around the world. There's about 2.8 million people worldwide living with this condition. And the problem is, despite its prevalence, there's barely any apps dedicated to helping people living with it. And last but not least, as a researcher, I'm intrigued by its complexity and heterogeneity. So that makes it particularly hard for designers and researchers to design for. So it's, if you don't know much about it, it's a disease of the central nervous system, and is associated with both physical and cognitive symptoms that relate or impact everything: vision, mobility, sensory, hearing, speaking, you name it. MS has an impact on it, overall mental health. And the heterogeneity part is that the journey of each person with MS is really, really different. No two people have the exact same symptoms. Some people have a single symptom and then they can go months or years with absolutely no other symptoms. Other people start with very light symptoms and then it progresses and it gets worse and worse really quickly. For others, they go away and they never return. So, this kind of medical condition requires a high degree of personalization from the side of UX researchers and designers. So, let me share with you, before jumping into the principles, let me show you this person product share journey, which I think it provides an intuitive lens to think about the journey that a person and an app go through together. And then we can start thinking of, what does it mean for the person? What does it mean for the app, right? Because we have to consider both. So I think this is really intuitive, and I like to think of it as a relationship almost. So the three stages are pre-onboarding, onboarding, and daily usage. So pre-onboarding is like the first date. It's just that first interaction, that when someone just learns about the product or an app, and what do they know, how level. And the real challenge there is, do I know enough? Does the app offer something right away that convinces me to give it a second try? So if you go on a first date, it could go miserably and you never go to the second. It's the same thing. I open the app, the first thing I see, it either convinces me to look further or walk away. The onboarding is like the honeymoon stage. So this is where people try out the app, and it can go both ways, right? Either they're intrigued and excited by the app and what it has to offer, or they delete it, and that's it, right? So that's kind of a decisive moment. They ask themselves, do I want to keep this app on my phone or not? Do I want to engage in this long-term commitment or not during the honeymoon, right? And that's what takes us into the daily usage or the long-lasting partnership. So this is where people and apps spend most time together. This is where all the content and functionality lives, and most product teams spend a lot of time in this stage, in designing the stage and making it perfect. But the problem is, if we ignore the first two stages, not everyone's going to make it to the daily usage to discover how awesome the functionality is, right? So when I think of the principles that I'll share with you, I like to think of them of which stage they belong at and how do we apply them at each of these stages to make sure we don't lose any users along the way before making it to the daily usage. So let's jump right into the 13 principles and see how the MS app we picked, it's called Emmeline, how it meets or doesn't meet these heuristics. So as you can see, this has all of the 13 heuristics. I'm confident that these principles, such as trust, transparency, and credibility, motivation, individualization, or personalization, they resonate with all of you across a wide range of products. So I am sure these words speak to all of us and we have ideas of what to do with them, right? But the trick is to systematically assess whether a product or a solution accounts for all of them at the right stage in a meaningful way, right? Because it's not enough to have rewards. You have to have the right kind of rewards and at the right stage, for example. So to do this successfully, at Macadamian, we have an interdisciplinary team and we have expertise across different fields from behavior change theory, cognitive science and neuroscience, the psychology of habit formation, as well as gamification design to either assess whether a product has and meets these principles or craft new ones that are fully embedded into these principles. So really, just if you could be a wall on our projects, it takes a village. And now I'll take you through them one by one. So the first one is trust, credibility, and transparency. And as we all know, and it's intuitive, it's crucial that people trust the app or the product, particularly in the healthcare field, where you need so much personal information to understand users' needs and to tailor to their experience, right? So we need to trust the app. It needs to have a credible source, whether it's done by professionals in the healthcare field, a scientific community. There needs to be something that convinces me as the user to trust the app. And it has to be transparent about what it does with all of these data that it collects from me, right? So, one way to gain people's trust is to be transparent about the data collected. So, simply put, as a user, I should know why the app is asking me the year I was born, the gender, when someone was diagnosed with MS, and so on. Like Emmeline asks for all of these things, which are necessary, but what it fails to do is tell the user how sharing all of this information benefits the user. So the second principle is motivation. And this one is really interesting in a healthcare context, right? Because if you think back to all of the talks you may have attended and all the books throughout the years, all UX researchers and behavior change experts, they talk about intrinsic motivation versus extrinsic motivation and how extrinsic motivation is great, right? Sorry, how intrinsic motivation is great. But at the end of the day, the reality is that in healthcare, we often have to deal with extrinsic motivation, not intrinsic. So if someone just gets diagnosed and they need to start the treatment right away, they do not have the time to understand their diagnosis. They don't have the time to acknowledge it and develop an intrinsic motivation. They need to make a change. They need to start their treatment then and there. So, from an app perspective, the app needs to first figure out if someone has intrinsic or extrinsic motivation, and then based on the answer, use different engagement techniques. And unfortunately for Emmeline, I don't have a good example for motivation because the app doesn't seem to capture and account for the user's motivation. But I pulled up an example for Noom, which is an app that helps people change their eating habits. So what Noom does is that it asks people what is their super goal, for example, losing weight, and then it keeps on asking until it uncovers someone's ultimate goal, such as being in control of my health or improving my confidence. And once it figures out this goal, then it really makes use of it to provide a truly tailored experience. So this is one of the places where the MLN app failed. This principle is beyond straightforward, right? Individualization or personalization. Successful apps should provide experiences that are truly tailored to their users' needs, motivations, personality, where they are in their journey, and so on, right? So, one very easy step, and the way Emmeline does this towards personalization, is to address users by their name rather than some generic message. So, this is a win for the app because it starts building that rapport with the person. You feel like the app knows you, cares for you, and it's speaking to you only, right? And that's a good motivator. Another great example of individualization in MLN is that it allows people to enter custom symptoms. So, in multiple sclerosis in particular, we mentioned earlier, it's a very heterogeneous condition. So, that list of symptoms we talked about related to mental health, vision, speaking, and so on. Well, some people may experience unique symptoms, and the app can't shouldn't go ahead and list maybe 50 of them, right? But at the same time, it should be able to capture everyone's unique symptoms. And Emmeline acknowledges that, and it allows users to provide custom symptoms. The education principle is one that unfortunately is far too often overlooked. And it's huge, particularly when someone was just diagnosed with a medical condition. People are overloaded by information, right? And this is where apps can come in and facilitate and help them understand, how do these tasks within the app benefit me? How do they contribute to my ultimate health goal? Because if I don't understand how sleep relates to diabetes, then I will never follow the challenges or the goals related to sleep, or how water relates to, or hydration relates to epilepsy, and so on. And multiple sclerosis, vitamin D is a huge factor. Not everyone knows that. So if there's no explanation for it, people will think it's just irrelevant. And that's where that educational component comes in. So, in the onboarding stage, Emmeline asks people to select what type of multiple sclerosis they have, which, it's a good sign because you think they will do something with that information. But unfortunately, it completely fails to help users select the correct type. So, people early in the process, maybe they don't know yet or understand the difference between, let's say, relapsing remitting or progressive multiple sclerosis, or what's a clinically isolated syndrome. So, this is a missed opportunity for providing that educational component. And users respond to it. So, this is a review posted by a user, and we see the need for education explicitly stated. They want to understand the details and symptoms for their specific type of MS. I would love it if there was a feature that would go into depth on what and why exactly the symptoms happen. Tips for each symptom, right? So people need this level of education. The fifth principle has to do with goal setting and revisiting. So, successful apps should provide an opportunity for people to set reasonable goals that are science informed and that serve as milestones along the way towards accomplishing their ultimate health goal. So, there's a path. We have an ultimate health outcome. And there should be a path of crumbles, tiny habits, mini goals, stepping stones that we go through, set them, and if we're failing, have the opportunity to revise them to see how we're building or walking towards that ultimate health outcome. So once again, unfortunately, I have no good example from Emmeline because to the best of our assessment, it did not prompt users to set specific health-related goals. So I'm going to show you an example from Quit Now, which is an app that aims to help people quit smoking. So what it does is it allows people to track goals. And what really, really impresses me about this app is that it actually includes both goals that speak to people's extrinsic motivations, but also that speak to people's intrinsic motivations. So, for example, it tells you how much money you saved, which is an extrinsic motivation, but it also tells you how much time you've won back, which is intrinsic. And very closely related with the app allowing you to set goals and revise them, assuming it has goals, it should also allow people to track their performance towards these goals and give them feedback. Tell them, how am I doing? Am I on track or not? And if I'm not, I need actionable guidance. Tell me what to do. Tell me how to get back on track. But since Emmeline does not support goal setting, as far as I can tell, of course, they underperform on this heuristic as well. So I'll jump on to the next one, which is reminders. Reminders and repetitions are key to forming a new habit. We need to keep doing something until it becomes a habit for us to truly change our behavior. And successful apps have complex and meaningful reminders that go far beyond a simple alarm, right? They should be flexible, they should be easily personalized, allow for feedback. Maybe I don't need it every day anymore if I'm getting better, and so on. Because the reality is, if the alarm would work, we would never hit the snooze button in the morning. But I don't know about you guys, I'm pretty guilty of that one. So it definitely doesn't, a traditional alarm does not work for me. So Emmeline allows people to set reminders for medications and for appointments. So it has the functionality, but it misses the opportunity of teaching people and helping them to create habit associations or helping them follow through with the reminder. So a really easy technique to embrace a new habit and do so quicker is by associating it with an existing established one. So we call that habit stacking. For example, if you have a tea or a coffee every morning at 7 a.m., and that's an established routine, that's something you've been doing for years and years. And now you also want to start taking vitamin D because it helps with multiple sclerosis, but also everyone, particularly in Canada, there's a deficiency. Well, then one easy way is to start taking it at the exact same time. Put the bottle of or box of vitamin D next to your favorite coffee or tea or coffee cup, and you're almost guaranteed to embrace that habit easily because you're associating it with an already very powerful habit. And Emmeline missed that opportunity. Engagement mechanisms refer to all kinds of techniques, whether they're cognitive behavior techniques or gamification ones. And the idea is that these techniques help the person stay on the path, and keep using the app until they meet their goal. And this can include things like rewards, journaling, loss aversion, and so on. But they have to match the user's motivation and they have to have a scientific basis to them. For example, rewards are not about, just saying you have a badge, you have a reward because you've accomplished something, check mark, the app has rewards. The science of it teaches us that dopamine, so that positive reaction that happens in the brain, is not because of the reward itself, is the anticipation of the reward. So that tells us something. That tells us that rewards should be unpredictable and so on. So it's not as easy as adding the functionality. As engagement mechanisms, MLN is pretty sparse, but it does support a journal function or a version of it. So it asks the user if there's anything else they'd like to add. And this is as close as they got to a journal. But the problem with this is that it fails to highlight the value of journaling. So journaling is a very, very powerful cognitive technique, but people don't necessarily know that journaling will benefit them. So then what happens is that that's where the education component needs to come in and tell them, hey, this is the value, or there is value in this technique, and help us get motivated to do it in the first place. Number 9, aesthetic experience. So this one's a very overlooked principle. And what it has to do with is the voice and tone of the app, the colors, the theme, the imagery. All of these need to match the intent of the app. Let's see how MLN does. Well, MLN is pretty pleasant and inviting. The colors are calm and relaxing. And one great quality of it is that while inviting, is also discreet. So what do I mean by that? So I'll read to you a review by a user, and I think this says it best. Emmeline doesn't scream, I have MS publicly on this pop-up or the app name or logo, which is nice if you have your phone in view of others. So the huge advantage of this is that it respects its users. Not everyone wants to share publicly at a restaurant or anywhere else that, hey, you can see my app from a mile and it tells you I have MS. So that level of discretion is part of the aesthetic experience. The human connection, well, this one is very universal. So human connection is something that all users have in common, right? Like we all have, there's a universal need for human connection. But the trick here is to remember that human connection doesn't necessarily mean interacting with the person one-on-one. Some of us don't need or want that. It can also mean indirect exposure to other humans. So learning from their stories, learning from opportunities, or having opportunities for competition or group activities, but without necessarily having that one-on-one interaction. And most people want to know they're not alone, but too many apps connect you directly with another person, which is not always the right approach. So what MLN does is that it provides an excellent opportunity for people to collect with individuals in a similar situation. So they can relate to this, and that part is really, really good. But the problem comes when someone uses it for the wrong purposes. So then there's safety concerns because there's a need to moderate to some degree. And that part can get tricky. I've seen reviews talking about, well, I'm not here to date. I really want to connect with someone, and so on. So that's where that one-on-one connection through a peer system can get a little bit challenging. The relevance principle states that both content and functionality, they have to be relevant to the user's needs and health outcome. So people should understand how the things in the app, whether they're tasks, goals, challenges, how do they contribute and how do they help them reach their goals? So Emmeline starts with a very rich onboarding, which typically is a pretty good sign. However, unfortunately, despite of collecting all of this information, as far as I can tell, it doesn't change anything. So Kyle, my student, and I tried the app by selecting different types of MS. We've tried clinically isolated syndrome, we've tried relapsing remitting, and changing the type of MS did not seem to change the content or functionality to make it more relevant to that specific type. And I know for a fact those two are crucially different in terms of symptomatology. We're almost done, last two. Transcendence and Empowerment. So this principle is about helping users grow. So let's say someone uses an app to get better at taking their medication or treatment on time. After a while, they get good at it with the help of the app. And transparency and empowerment is about what's next. How do we help the user after they've met their primary goal? What are some ways to keep them engaged and still help them? And that includes satisfying universal needs, which include feeling good, human connection, the desire to keep on learning, and so on. So what Emmeline does is that it creates an environment where people are empowered to keep on learning and stay current with new research, new innovations in the MS community in a timely fashion. So it talks about the relationship between MS and COVID. It talks about, it gives quizzes, helps you stay up to date, new research going on, and so on. So it does really, really well on this principle. And last but not least, when designing an app, product teams need to remember that these apps don't live in isolation. Particularly in a medical condition, people change, their symptoms get worse over time, and environment changes too. We see this with COVID. What was possible before is no longer possible, even simple things like going to the gym. And sometimes we forget the importance of that, but going to the gym may be huge in managing something like diabetes. You take that away, you take away the means to achieve physical activity, right? So apps need to respond to things like that. And this is just a visualization to show how these apps don't exist in a silo. And there's an intricate relationship between the person, the app, and the environment. And the app needs to capture changes in the person and the environment and respond to both of them. And Emmeline does this quite well. It provides educational opportunities. It offers information about COVID-19. It has quizzes that are kind of tailored to the pandemic and addresses concerns that people may have with vaccines and so on. So it does really, really well at accounting for people's current environment. And that was our last heuristic. So what I really want you guys to take away is that behavior change is really, really complex. And forming a habit does not happen in a silo. We need to account for our environment and changes in us and the environment. And these behavior change heuristics are a means to capture whether an app has what it takes to lead to meaningful behavior change. And they're an additional layer to usability. They don't replace usability, they complement it. And with that, I thank you on behalf of myself and Kyle, and leave you with several resources if you'd like to read some more.
Roxana, thank you so much for that. Appreciate it.
My pleasure.
Fantastic. So with the resources, is there a link you can leave the audience that they can just go to?
Yeah, for sure. I will add them in the chat.
Fantastic. Thank you so much. Okay, so we've got 3 questions here for you. I don't know if you mind answering them. So
Not at all.
the first questions we have from Ragwa. What's the best user experience approach to gain patients' trust and ensure medical data secure, as well as following the medical data sharing regulations?
Sorry, can you say that again? I missed the first part.
What's the best user experience approach to gain patients' trust and ensure medical data secure, as well as following the medical data sharing regulation?
That's a very complex question. So I think there's several layers in there. So gaining patients' trust, it really depends on the condition you're dealing with. So that's the first heuristic, right? Like trust, credibility, and transparency. So the first easy steps are about really being transparent. What data are you collecting? What are you doing with it? And then the credibility component is, well, if as a product you're claiming you can accomplish something, what gives you the authority? Are you backed up by lots of studies published by an established scientific community? Do you have a medical team working side by side with you, and so on? And for the back end part, that one is outside of my expertise, and I leave that to our HIPAA related and the rest of the team. I know a lot goes into that, so we're HIPAA compliant. We have we have offices across the world, so each country has its specific regulations. So that one is really being up to date with the law and having the right people at the table to account for it, because I don't think it's part of a researcher's expertise to a full extent. There's far more beyond that goes into that.
Okay, thank you for that. I think the next question you pretty much covered it as well, just with regards to GDPR and just regulation within Canada. I think you're absolutely right. I think every organization does have specialists dealing with that. I know Canada's got its own issues when it comes to the POPI Act or the
Yes,
Data Protection Act as well. So I'm sure when it comes to your applications that you're designing, Macadamian has got these people that look after that for you.
that's exactly it.
Okay. Just on another question, how do you moderate notification overload?
That's an amazing question, and that is huge, and fully pertinent, particularly now as we're all experiencing Zoom fatigue, right? Like it's not just about extra using an app and having extra notifications. Now it's a ton of screen time from all directions, whether it's catching up with family over Zoom or work or the 3 apps that you help to change your behavior on your phone. There's too much. So there's a few ways to deal with that. One of them that I feel really, really strongly about is one is personalization, right? So as someone gets better at responding to the notifications, so let's say the reminders, allow them the flexibility to change how often they get them. And unfortunately, it's something so simple, but too many apps fail. If after, let's say, 7 days, 21 days, 30 days, whatever it takes for you, you do it perfectly and you don't miss any. Let's say you're taking a pill at a certain hour, you have no misses, then there's no reason why you can't decrease the frequency of the reminders. Another way is to really listen to your users. If the notifications are content related, allow them to upvote or downvote and respond to, listen to that. If there's something that your user doesn't want to see, don't do it again. It's as simple as that. Like all those extra pushes eventually send users away, right? If they're not desired. And probably my favorite one is, as an app, acknowledging that we don't actually want, particularly in healthcare, like our intentions are good. We do not want users to be app dependent. So it's finding those ways to teach them to change their environment. So if we're talking about reminders, it's teaching users to have sticky notes around the house. Fabulous is an app that helps people form new habits, and it advises you to put sticky notes, whatever you want in the house, that tell you, hey, you have to do this without having to touch your phone in the process. Modifying your environment. For me, I'm not very good at drinking water, so my whole family knows. So I am surrounded by cups of water, and the app itself told me, modify your environment, have water in these places. So it's really teaching, giving people the skills to take some of these outside of the app. We don't need people to be app dependent to benefit or engage with an app long term.
That's a fantastic answer. I really do like that. I think you hit it on the head there. The more we've become so reliant on Zoom, that people are becoming app dependent, and I think it's becoming an addiction where people don't realize that it is. Oh, that's you. It's
Yes.
fine. It's fine. Where people don't realize that app dependency is actually a problem, which is probably going to be treated medically. I think there's another question. Do I need the patient's consent to use medical records to personalize the app for better user experience? That's from
I,
right as well.
I think you always need patient's consent for
Absolutely.
anything. And I think that's a great question to ask, because really, a lot of these app, like health and wellness apps, they're not FDA approved. They're not treated as medical, but the information that they use, right, is so personal and it's so invasive. They're kind of at the boundary, so it's up to us as researchers and designers to steer that in the right direction and really push towards transparency and teaching the users how we're using their data and collecting the minimal amount of information that we need to help them.
Absolutely. That's correct. You do need to get consent.
Yeah.
I think you can land into all sorts of troubles when you're using that information without consent.
And the
Okay.
trick, sorry,
So
I was going to say the trick with consent is, right, like when it comes to healthcare, there's no room for inequality. And too many consent forms that I've seen in hospitals and in many sessions, you can't understand them. There's pages of like legalese and like fancy words. So it's also taking the time to write that consent form or that information about what's happening to the data at a level that everyone can understand it, because if not, you're doing a disfavor to a big percentage of the society.
absolutely. Okay. Roxana, thank you so much for that.
Thank you. Goodbye, everyone. Thank you for
Bye-bye.
having me.